Welcome, everyone. We are so glad that you are joining us here today, and I'm very excited to introduce you to our special guest, Dr. Kristen LaMarca. Kristen is a clinical psychologist who has expertise in applied psychophysiology, sleep disorders, and lucid dream therapy. She's also a co-facilitator on the intensive retreats at the Stephen LaBarge Lucidity Institute, I think I got that right, and has published research maximizing lucid dream induction techniques. Welcome, Kristen.
Hi, thanks so much for having me. Honored to be here.
Wonderful. We're so glad that you are here. And let's just dive right in. Let's begin with what is a lucid dream and lucid dream therapy and how they link.
Mm-hmm. Well, lucid dreaming is a very special type of dream. Ordinarily, when we're dreaming, we don't really think about the fact that we're dreaming. We tend to treat our experiences as real, and this tends to restrict the range of experiences that are possible. So in a lucid dream, you can train yourself to recognize the state while you're in it. And so you do this through various forms of memory training, I'm sure we'll get to talk about. And once you realize it's a dream, the experience changes completely because you're able to connect more with a sense of safety. You know that your physical body is in bed, there's no social contingencies. So there's a lot more malleability in the dream state. And this opens up so many new possibilities for people to explore. This can range from creativity and fun. And of course, lucid dreams, they are very fun. But it makes experiences that are less accessible to people more accessible. So you can explore so many different things. It's a window into yourself. It has what we would call autonoetic features. So self-knowing, getting to know yourself. You can receive guidance and insight from this state. Dreams, they tend to involve a lot of emotional processing too, ordinarily. So you can use lucidity to better process emotions, heal from things. This is also a state that is disconnected from the physical world. So sensory inputs, for example. And because of that, a lot of people are more able to explore spiritual states or higher states as well. Scientifically, we can do experiments in the lucid dream state to actually teach us more about the nature of our mind. So the possibilities are really endless.
Right.
And lucid dreaming therapy, well, it's a novel therapy. So that means it's not researched very well. It's newly being developed. And it's a tool for therapists to integrate dreams and lucid states into evidence-based practices. So things that we already know work to help people recover from various conditions or illnesses. And you can weave this into the interpersonal processing during therapy to help patients overcome their defenses, think more flexibly, overcome blind spots. The lucid state is also very much associated with a sense of safety, psychological safety, as well as physical safety. And that is one of the most critical ingredients for therapeutic growth. So this can really help bypass a lot of challenges or resistances in the therapy room. There's very special applications for this. One being its potential for helping people resolve nightmares, also just explore themselves or some of the problems that they're having in the waking world. It has very specific applications for people that have like sleep paralysis attacks, repetitive nightmares. It can help people that have REM behavior disorder, where we act out our dreams in certain types of circumstances. So it has a lot of potential, and it's something I'm very excited about.
Yes, I completely agree with you. Everything you've said sounds so amazing. So let's take it one step back. So you have a background you're a psychologist. How did you get into this?
Mm-hmm. When I was in my undergraduate studies, I learned that lucid dreaming was a thing in one of my psychology classes, and it just was life-changing. From that moment on, I began lucid dreaming. This was around 2005 or so, And when I went into my graduate program for clinical psychology, I connected with Stephen LaBerge's Lucidity Institute. Stephen, he's world renowned for his research studies in inducing lucid dreaming and validating it. And so I began attending his yearly retreats and co-teaching with him. We conducted research together on an integrated protocol of induction skills. Got to explore the light cue induction devices like the Nova Dreamer that flash lights in your eyes so you can recognize them in the dream state. We did a study that also incorporated an experiment where we would give a placebo and a memory enhancer, a supplement called galantamine. And we showed that that can increase people's odds of getting lucid in the dream state, even above and beyond all of the other techniques in that integrated protocol. So during that time, I was also doing my clinical study, so I got to weave in the knowledge of lucid dreaming into my training. And eventually I went into private practice. I established a group practice in sleep medicine, and we do a lot of mental health counseling. And it's been a really extraordinary opportunity for me to explore this, not just with regular, everyday, healthy individuals, but also people that are really sick and suffering. It's been a really phenomenal opportunity to see lucid dreaming in real world practice rather than just theoretically. And it certainly has a lot of applications I'm sure we're going to get to talk about today.
Right. So one of the applications that you speak about in your book, How to Lucid Dream, is on the effect of lucid dreaming and nightmares. Do you want to speak about that a little?
Right. So nightmares are, especially in the field of clinical psychology, they tend to be ignored. They're just seen as like a symptom, and most therapists, they'll focus on treating daytime issues or symptoms. But nightmares are really a window into people's suffering, and they can be targeted directly. They shouldn't be ignored. It's ironic that the field of psychology started out very much focused on the dream world, and since then we've steered away from that. But I'd love to see that come more full circle, because by teaching people to lucid dream, they can overcome that feeling of helplessness around their nightmares, where there's like nothing that they can really do about it. And people that have nightmares, especially in the clinical world, they tend to have increased REM, so REM intensity. So they have more REM sleep than most people tend to have. And those experiences can be intense, repetitive, disturbing, horrifying, and they don't really feel like they can do anything about it. But lucid dream has very specific application to this, because you can teach these people who already have a very vivid recall, which is a characteristic that helps people get lucid. It's very associated with lucid dreaming. They can pretty easily become lucid in their dreams. And once they establish that they're safe, their physical bodies in their bed, and they're going to wake up, they have new opportunities available to them to reshape the dream experience, feel less helpless, feel more empowered, and also explore parts of themselves that might actually be too threatening to really face in other regards. So there's a lot of features of this state that can really help people relate with themselves in a different way, and help them grow therapeutically.
Yeah, definitely. So in a nightmare, I think most of us can empathize with the situation where you find yourself in a nightmare and the response is either fight, flight, or freeze. And this is something that you speak about specifically in terms of the connection to lucid dreaming. Can you expand on that a bit?
Mm-hmm. Well, one theory around why we dream is that our dream states are related to creating new learning and memories, and potentially nightmares have been a way for us to rehearse survival responses to threats, and this possibly helped us evolve as a species and get to where we are now and survive. But this pattern continues in nightmares, right? So usually when we are in a nightmare, we have some sort of response that reflects our nervous system. So the fight, flight, or freeze responses. So often people feel very helpless in nightmares. They don't feel like they can do anything. They might feel trapped or frozen. They might be overcome by some sort of hostile figure, or they might have a shutdown response from how disturbing the imagery tends to be. And if they don't have a freeze type of response, usually they're trying to avoid the situation. So our flight response, potentially trying to get away, run if you're getting chased. And also people, they tend to fight back sometimes in their nightmares. But the problem with these reflexive responses is that they keep us stuck in a pattern where we never really resolve the nightmare. And there's pros and cons to each of these types of responses, but a better response is to become lucid and try to engage with the nightmare imagery in an open, compassionate, curious type of way. This has a lot more potential for therapeutic growth rather than relying on our automatic responses where we're trying to get away from what these nightmares tend to represent.
It has amazing applications potentially for waking life, right? Because the same responses follow through in sleep and waking life. So if you tend to, fight in life, you tend to fight in sleep and vice versa. And I know that's something that you talk about in your book, How to Lucid Dream. And so I hope anyone who's listening to that just hears the amazingness that is that actually if you can learn to lucid dream and face your nightmare in the dreamscape, you are potentially giving yourself the opportunity to rewire consistent patterning, to reframe it potentially even. Yeah.
Right. That's such a good point, right? Because you would think that you could do this in the waking world. You don't really need to do this in nightmares, but lucid dreaming really gives a better platform to help us face our fears because of that sense of safety. It's not real, you're going to wake up. So that really gives people a boost in learning to practice. How do I sit with and stay with the things that make me uncomfortable, the things that feel threatening, and how do I engage those things in a deeper dialogue? And because you have this reality to explore this in the lucid dream state, you can learn how to do it better in waking life. It generalizes, and we see this all the time in the lucid dreaming therapies.
Right, which is something you specialize in, which is amazing. What do you think the current psychological trends are in relation to dreaming, at least in the clinical space?
Well, like I said earlier, nightmares, they do tend to be ignored, but there are some interventions that can help people. And, there are non-psychological reasons as well for people having nightmares, like physical conditions, sleep apnea. And so those are obviously better treated with certain types of interventions that we really know work. But there are some treatments for nightmares, such as medication, for one. And specifically, there are some that can really dampen that REM intensity and help people not have intensive dreaming or nightmares. And the first line of treatment, though, is something called imagery rehearsal therapy. So this is basically where you take a dream and you try to resequence it, you rescript it. So in the therapy room, you talk with your therapist about, well, if I could change this dream and do something a little bit different, what would I do? And this can have an empowering effect on the dreamer. It helps them not just run away and avoid the dream altogether, feel helpless by it, but they can engage with it, try to understand themselves better. They can learn more about their thinking processes, their emotions, their reflexive or automatic responses they tend to take. And that in itself, I think, can be really powerful. But imagery rehearsal therapy, it doesn't work for everybody. It has a pretty good effect, but there's limitations to it. And, that's one of the benefits of lucid dreaming therapy, because it can help people overcome some of those limitations. often when people are doing imagery rehearsal therapy, they get kind of stuck in this mindset that whatever they're dreaming about is still kind of real. They don't really have as many choices available to them, but from a lucid frame of mind, they very much do. And so this doesn't even have to occur in the lucid dream state. It can occur in your imagination. And lucid dreaming is something very easy to add on to imagery rehearsal therapy instead of just trying to change the dream script or story so it feels a little bit better for you or you learn about yourself. Instead, you change it in a way where you know that it is a dream. And this opens up so many more options available to people. And I find that if I just try to do imagery rehearsal therapy with a lot of people, they get stuck. And so introducing that lucidity model can broaden their flexibility in relating with the dream and really help them overcome some stuck points in therapy.
Right. And the applications are profound, actually, if you think about the scope that it gives you access to. You know, I know that if I'm re-scripting a dream or trying to reframe something, it is incredibly helpful. It's the same way journaling is quite helpful. But in a lucid dream, specifically for anyone who's never had a lucid dream, the experience, how it feels, is incredibly different. So it's moved from quite an intellectual space into a very, I mean, you could use the word embodied, but that's not entirely accurate, right? In the lucid dreamscape, because it feels very tangible. You know, so if you get a fright in a lucid dream, it's like you're getting a fright in waking life. And so changing that narrative in a lucid dreamscape is very different to imagining being frightened and then flipping the script. So I agree with you. I think they're incredibly complementary. And, you know, the applications could be incredible, specifically in the therapy room, which is, I know, something that you specialize in. Now, for any beginner listeners who are very new to lucid dreaming, can you share some induction techniques with us?
Mm-hmm. Well, one way to think about lucid dreaming induction is to borrow the phrase set and setting. So that relates to our mental set, the mindset that we bring to our dreams, and the setting would refer more to like the physical conditions. So as far as the mental set, this really involves memory training. So training yourself, one, to remember your dreams, but also to get to know what they're like. And specifically, you want to find points in the dream that are very dreamlike, that stand out as different, or there's a discrepancy from the waking world. So Dr. LaBerge calls these dream signs, or signs that you're dreaming. So you want to try to become more aware and remember these points in the dream where you want to adopt a critical, reflective attitude where you consider, could this potentially be a dream right now? So you try to establish what sort of events or emotions or thinking patterns that are reflective of the dream state and associate that with that questioning and recognition and remembering that you're dreaming. And there's ways to also complement that. You can practice looking for dream signs in waking life. So they wouldn't be a sign you're dreaming, but they might be similar to the dream state. So perhaps something odd or unusual happens, or something similar to something you tend to dream about happens. So that's a good time to practice that critical, reflective attitude, asking yourself if it's a dream. If you're in the waking world, sometimes we encourage people to solicit a dream sign themselves. If you do that, though, you want to make sure you do a reliable, what we call reality test. So something that we know in the dream world tends to be reliably unstable. So there's lots of different reality tests out there. But one we know, and I think is a good recommendation for beginners, is to read small printed text. And so you might take, something around you. It could be a coin or a street sign, and you read it. You look away and you read it again and you see if it changed. Then you do it one more time, but this time you look away and you imagine when you look back and read it that it's going to say something different. So you visualize that it might change or morph or disappear in some way. In the dream state, if you do that type of reality testing, just the way I described it, the rate that the text will change is incredibly high, something like over 95%. And so that's a good way to kind of test whether you're dreaming, and you could practice that in the daytime. But all of this kind of falls under the umbrella of Dr. LaBerge's mnemonic induction of lucid dreaming technique, where you, after you do this memory training, you use your own dreams as like a training ground. So you imagine yourself back in the dream, potentially a non-lucid one, or most likely a non-lucid one, and you instead resequence it, or you rescript it, and you choose a point where you would recognize the dream sign, and you would remember that you're dreaming. And from that point, you can imagine what you might do in that state, and you rehearse that a few times. And lastly, you want to set some intentions, or remind yourself in the future, I'm going to be dreaming, I'm going to recognize I'm dreaming, I'm going to look for these sort of dream signs. And it's good to do this before bed. Also, if you wake up in the middle of the night and you're about to go back to sleep, use the last dream that you recall to practice mild. You can also practice this in the daytime, or if you encounter something dreamlike in waking reality, even though you are awake, you can still imagine what it would be like if you were dreaming, and just reinforce that intention to become lucid, and that memory for looking for dream signs. There's other techniques too to help you prolong the lucid dreaming state, to time when you're going to be having dreams, usually early morning. So you could potentially elicit a sleep onset REM period and have lucidity after you wake up and as you're falling asleep. So you can have a lucid dream where you maintain lucidity from the waking state into the dream world, right? So this often happens when we have a brief awakening from REM sleep and we fall back to sleep. And there's several techniques to help people do that as well. Interrupting your sleep in the middle of the night, usually after like 4.5 or maybe 6 hours for a period of 30 minutes. We know that tends to result in more lucidity when you fall back asleep. So that's generally the setting for inducing lucid dreaming, and there's a lot of variation around that too.
Right. So thank you for sharing those. I think for anyone listening who's a beginner, those are exceptionally helpful techniques to start on the pathway of lucid dreaming. Now, I know you have offered to guide us through a practice of reworking with nightmares and reframing them. And so maybe we can begin that.
Yes, I'd love to do that. But, it might actually help to give you a couple examples of what people might be doing so they kind of know what to do in the experiential. And I could give you a couple of ideas of what this actually would really look like, so we can make it a little bit more concrete. And let me share maybe an example of a patient. I'll disguise this case, of course, who I've had several cases that have had like motor vehicle accidents, and they have these repetitive nightmares around it, and it's kind of interlaces with other challenges and problems in their life. And I've seen a few people get lucid, and there's one case I was working with recently who was having a lot of panic attacks afterwards, developed a driving phobia. He wasn't getting help in the world to help him address these issues. He became very depressed and suicidal. So he was in bad shape when he came to us, and we tried to get him stabilized with some therapies first. And pretty quickly we were able to start to look at the nightmares, because it was every single night that he was having these. And he would wake from his nightmares and go into a panic, and like a real panic attack that would be very prolonged. It'd be disturbing to his family, his children in the house and such. So it was a pretty brief intervention where we saw some success with this. And we taught him how to rescript the dream, do something a little bit different. And one of the dream signs that made sense to him, since he had a driving phobia, he knew that he was probably dreaming if he was driving again. So because he was having these dreams every single night, he could expect that he was going to have it, and set his mind to notice that he's dreaming. And so the action that he chose, we're going to try this in this experiential you're referring to, was to try and look for someone to help him. in the dream, some sort of ally, someone that could rescue him. And so he chose in his imaginary rehearsal exercise to imagine like a crossing guard or something, giving a detour to kind of go a different direction rather than straight into the crash that was impending. He practiced this before sleep, and the next time I saw him, he told me, well, I didn't really have any nightmares last week, which is pretty incredible, just alone from that imaginary rehearsal to kind of see that the nightmare intensity reduced. And, I was able to help him try to make sense of it. Well, look what happens when you focus on your nightmares rather than just feeling helpless and by them and trying to forget about them. When you voluntarily try to process them, your brain doesn't really have that force where it makes you focus on processing those experiences over the night. So that's really incredible. And he says, yeah, well, actually, I did have one nightmare. And so he tells me he was in a helicopter. And this isn't unfamiliar to him because he was an active duty soldier. So probably a bit experience with this. And he was in a helicopter. It was about to crash and he got strapped into his seat and he couldn't get up. So he started panicking and he was able to activate the same lucidity script. So he immediately looked around for a helper, an ally, someone that could help him. The co-pilot in the helicopter pressed the button and suddenly his seatbelt came off. So wow, that just was such an extraordinary change immediately. And what he was able to do, he was able to go up into the cabin and he asked the pilot if he could drive the helicopter to safety. And then he woke up just driving or flying this helicopter through the air and it didn't crash. So that was just such an incredible example of where someone who is seriously disturbed by their nightmares can do something completely different. And, the hope is that he's going to take this tool and continue to implement it and learn from it. But, there's other ways to try to relate with nightmare content. And I thought I could share one of my personal lucid dreams. And the one that came to mind for today was related to, I kept having a dream of a character that in my waking life who I thought had hurt me or mistreated me. And I didn't really want to keep having that dream. I wanted to heal from whatever that experience represented, whether it represented something specific, to that person or maybe more broadly related to me. And this is one of the helpful models of lucid dreaming in that if you become lucid, it's easier to take responsibility and ownership for your dream content because it is coming from your own mind and it represents something within you. So in this dream, there was something stressful happening. There was like someone trying to steal my parking space or something silly like that. But as soon as I saw him, because I set my intentions, next time I see him, I'm going to recognize I'm dreaming. As soon as I saw him, I became lucid. And I said, this is a dream. And I implemented what a lot of the classic texts on lucid dreaming teach you to do, which is to engage, attempt to integrate whatever the imagery reflects. So I went straight up to him, I grabbed his hands, and I looked him in the eyes, and I spoke from the heart. I can't remember exactly what I said, but it was something along the lines of, I want to heal from you. I'm open, I'm willing. Is there anything I can do to help myself with that? It's also helpful to ask if they need help. So this person represents something within me that's suffering. What can I do to help you as well? And as I was doing that dialogue, he just smiled, but then he disappeared. And the dream began to involuntarily make me start floating. This is not an uncommon response in lucid dreams. You kind of ask for something or you implement something, the dream will kind of pick you up and do something where you're not actually controlling it. It's involuntary. So I began floating and kind of somersaulting to the ceiling, and I was just effervescing in this blissful ecstasy. It was such an amazing feeling. It's not like anything I've really ever experienced before. And I was just trying to observe and not disturb the flow. I floated up to the ceiling and I was hanging upside down from the ceiling and just sort of effervescing in this energy and awe and amazement. whatever this represents. Imagine it represents the integrative process of lucid dreaming. And it was really interesting. As I was hanging there, I saw an image of a bat, which I thought was peculiar at the time. But when I woke, I recognized that I was actually hanging from the ceiling like a bat, like how they roost, right? So that was really phenomenal to me. And, not only did that this dream help me understand parts of myself that have maybe felt mistreated or displaced, kind of like metaphor for the parking spot being stolen, right? But this image of the bat, it really struck me as a metaphor for maybe something that I can relate to for strength, for deeper insights, healing, engaging with my dreams. Since then, I've seen that animal weave itself into different parts of other dreams as well. And I've found that this dream, the meaning of it has continued to unfold over time, even as I was reflecting on this dream with you to tell you here today, I started having more insights about it. So it's one of those dreams I'll probably take with me to the grave because it was so meaningful to me. But I wanted to share it because it demonstrates that you don't have to just try to get out of the experience or avoid it. This doesn't tend to work. Usually people, if they try to run away or wake themselves up, if they get lucid, the dream returns in some form or another. It doesn't really resolve. And so you do want to try to engage and integrate these images. I hope that is exemplary of some of the integrative processes we're looking for when we do these rescripting exercises and if you implement them in lucid dreams.
No, it most definitely is. And thank you so much for sharing that dream. What a powerful dream to have.
Mm-hmm. Yeah. I'm happy to do the experiential if you'd like.
Okay. Yes.
I think it might take us about 10 minutes. So for your listeners, I suggest finding a comfortable space. You can do it sitting up or leaning back. If you have the opportunity, you can try to lie down to your sleeping position. And we'll give everyone a second to just settle in. And you're welcome to close your eyes, or you can keep them half open, whatever is comfortable for you. And let's just try to induce a relaxed, open state of awareness. You might try to focus your mind on your senses, on your breath, anything that can anchor you in the present moment. Perhaps you might pay attention to the air passing your nostrils and throat. Or maybe you can feel your heartbeat. And as you settle into this inner space, I want you to choose a dream that you've had recently. Could be recent or any dream really. So choose a dream you want to work with for this experiential. It could be any type of dream. You're welcome to also choose a challenging dream or a nightmare. And once you've chosen a dream, I want you to revisit that dream. See yourself at the beginning of the dream and allow that dream to play out through the end, and see yourself experiencing it just the way it was again. Give you one more moment to finish recalling your dream. For your next step, you're now going to rescript this dream as if it was lucid. So choose a point in the dream where you're going to remember that you're dreaming. You want to choose a point where you notice a sign that you're dreaming, or a dream sign. So perhaps it was something unusual or typical of your dreams. And once you notice that dream sign, I want you to imagine how your thinking would change. You notice the dream sign, and then you notice that you are dreaming right now. Perhaps you say aloud, "This is a dream," to reinforce your lucidity. And now that you're lucid, I'd like you to re-script what the rest of the dream would have been like. So you're going to change the original script of the dream to one that is lucid. You're welcome to explore a pre-selected goal, something you're curious to explore in the lucid dream state. Or you might like to engage with the spontaneous imagery already present, perhaps seeking self-integration, self-understanding, healing. Take another moment to explore how you would resequence your dream as if you were lucid. And now that you've decided how you might relate with this dream differently, I want you to stay in a relaxed, open state. And I would like you to mentally rehearse or imagine the re-scripted version of your dream again. Put yourself at the beginning of the non-lucid dream. Imagine yourself getting lucid. And then imagine carrying out some activities that could only be carried out, really, if you were lucid dreaming. I'll give you a few more moments to finish up. Make sure that as you rehearse this new dream, you don't speed through it. Feel your feelings, sit with the sensations. Consider how your thinking might change if lucid. You could do this once or multiple times, as many times as you're willing. Now, for your last step, you're going to set a reminder or an intention to carry out something in the future. And that is to remember to recognize you are dreaming. Really try to sit with and feel that intention, knowing you'll be dreaming tonight, knowing the different types of dream signs you will dream about. You might say to yourself, tonight when I'm dreaming, I'm going to recognize I'm dreaming. Or the next time I encounter a dream sign or a specific dream sign, I'm going to remember to realize it is a dream. And as we end this exercise, know that this is something that you can do before sleep to increase your odds of lucid dreaming. It can be something you do in the middle of the night or when you wake from dreams. And whenever you're ready, you can slowly open your eyes, wiggle your fingers and toes, and reorient back to the room that you're in.
Thank you so much for sharing that.
You're very welcome.
Incredibly powerful and amazing that in a short couple of minutes you can completely alter an experience.
Mm-hmm.
Yeah. So before we end off today, firstly, where can people find you and your work? And secondly, if there's anything you'd like to leave our audience with, then please share.
Mm-hmm. Oh, you can learn more about me at my website. It's kind of a hub for a lot of my work. And this is mindfulluciddreaming.com. If you want to stay in touch or learn about more activities to learn lucid dreaming, feel free to subscribe to my mailing list. And I guess the one thing I'd like to leave everyone with is my gratitude for having me here. And I really hope that this space that we created today is going to help you be more connected with your dreams, and not just connected, more lucidly connected. I hope if there's a main takeaway that people gather from our talk today, it's that lucid dreaming has a lot of potential. It's a very powerful tool, and with the right training and techniques, it's not as difficult to access as you might think. So I just want to offer that encouragement to people.
Exactly. Thank you so much. It's been wonderful connecting with you.
Thank you, Athena.